Hello, can you all hear me?
Hi, Dr. Abe. Yeah, we can.
Can I? Okay. Good afternoon, ladies and gentlemen. Welcome to the live webinar, which is being organized by the Academy of Occupational and Environmental Medicine Malaysia, AOEMM, in conjunction with the Asian Congress on Occupational Health 2026, to be held on 5th to the 8th of August this year in Kuching, Sarawak, Malaysia. For today's webinar, we are having the topic TB, tuberculosis prevention and control in the workplace. And we are very, very fortunate to have with us, and honored to have with us, Dr. Rima Melati, who is a occupational medicine specialist and a lecturer at the President University in Indonesia. Basically, Dr. Rima is an occupational health or occupational medicine specialist in teaching at the university, and specializes in occupational health services in corporates and in hospital settings. She is also an executive board member of Perdoki, which is the Indonesian version of AOEMM. And we are really, really pleased and honored to have Dr. Rima join us today and to help share with us her views and her efforts and what she has done in Indonesia to prevent and control tuberculosis in the workplace. Just as a reminder, can we turn to the next page, Shakira? For this webinar, I would like to request that all of us keep your microphone muted while the presentation is going on, number one. And of course, in that process, try to stay focused during the session. I know it's quite hot out there today, and just having lunch, you might feel a bit drowsy. So I hope that the content of this presentation will keep you awake. And if you have any questions, any comments, please use the chat box and type in your question or comments, and we will address them at the end of the session, okay? And if there are any confidential information shared on this webinar, you'll be told that it's confidential and you're not supposed to share it outside of this webinar, okay? We will also be recording this session and will be available on the ACOH 2026 website. And you can always go back to listen to it again on parts that we have missed out and so on and so forth. Now, for Malaysians attendees, you can, if you attend this session, you'll be given the CPD points under the registration with MMA. Okay, so with that house rules out of the way, I would like to welcome Dr. Rima Melati to tell us or to take us through this journey about how to prevent and control tuberculosis in the workplace. Over to you, Dr. Rima.
Okay. Good afternoon.
Good afternoon. Yes.
Thank you, Dr. Abed, for introduction about me. Good afternoon, distinguished college respected expert, ladies and gentlemen. It's truly honor to be invited to speak at this ACOH 2026 Congress webinar today. To share insight on a topic that is not only clinically important, but also economically and socially critical. Can you hear me? Can you hear my voice clearly, Dr. Abid?
Yes, very
okay,
clear.
Thank you. Today, I will discussing a topic that sits at the intersection of occupational health, infectious disease control, and of course, economic productivity. We will discuss about tuberculosis prevention and control in the workplace. Now I want to start with a simple reflection about this. Yeah, when we talk about tuberculosis, we often think this only in a hospital or patient with medication. We think about the patient, we think about the treatment, but rarely do we ask where does transmission actually happen, and more importantly, where can prevention be most effective? The answer is very clear. Workplace. Yeah, tuberculosis is not only a medical problem, it is a workplace problem, an economic problem, and a system problem. I want to share my window first. Can you see the slide, Dr. Abed?
Not yet, not
Is it
yet,
already?
not yet.
Not yet?
Belum lagi ya.
Belum.
Belum,
Okay,
belum.
maybe a moment.
Yeah.
Yeah, and we fail to address TB in the workplace. We are not only failing patient, we are failing productivity, we are failing national development also. Is it already up here in the slide? The window?
No,
Not yet?
belum
Oh,
lah.
what is the problem? Sorry. Let's start it again. How about this?
No, still no, nothing.
Not yet?
Yeah. Shakira, do you have a copy
Can
of
you
the
help
slides?
me, maybe?
Yeah.
Dr. Abed, yeah, sure, in a moment, yeah.
Yeah.
Okay, something happens with the internet connection, maybe.
Yeah.
Sorry.
No, it's okay. There you are. Yes.
Yes. Thank you. Maybe we can go to the next slide. Yeah. Yeah, this is what the topic we want to discuss today about the TB prevention and control in the workplace. Next slide, please. Next slide. Yes. Next slide. Yeah. Yeah. So today I would like to share about this topic in structured and practical ways. So by the end of the session, I hope we will be able to know about the epidemiological burden of TB globally and in Indonesia, about workplace-related risk factor and occupational TB, and how to integrate TB control into occupational health system, and how to translate knowledge into actionable occupational health strategy, policy, program, and practice in the workplace. Next slide, please. Yeah, let's begin with the global perspective. Yeah, according to the latest global tuberculosis report in 2025, TB remains one of the leading infectious causes of death worldwide. And what is striking is this: just only 8 countries account for nearly 2/3 of global TB cases. Yeah, about 67%. Yeah, from only these 8 countries. Indonesia is among them. Indonesia is the second largest, contributes around 10% of global TB burdens. Yeah, after India, India contribute around 25%. And now let me emphasize something very important that we can see here. TB is not evenly distributed across age group. In fact, the majority of TB cases occur in adults of working age population. More than half are men, about 54%. And so clearly, this is not just a health issue. This is a work issue from an occupational perspective. TB is fundamentally a workforce disease. Yeah. Next. This is a TB situation in Indonesia. Indonesia now in the second rank in the world for TB, with the estimation cases about more than 1 million, and the incidence rate is still very high, about 382 per 100,000 population in 2024. And more importantly, more than 60% of TB cases occur in productive age group. So let me emphasize this, that 2/3 of TB patients are workers. This means people who are actively working, supporting families, and contributing to the economy. So when TB occurs, it's not only affect health, it affect the income, the productivity, and of course, can be impact to national development. Next. We see about the burden now. Indonesia also classified as country with 3-tier burdens. Yeah, for TB itself, we are the second ranks, and for HIV associated with TB and MDR-TB, the cases also arise. Yeah, recently. Yeah, so this is a burden for our country with such many cases of TB. Next slide. That's why Indonesia has already made a roadmap for TB elimination according to global targets. Yeah, we has committed to reduce the incidence to 65 per 100,000 and reduce the mortality rate to 6 per 100%, 100,000 population, and achieve more than 90% treatment success. We aim to significantly reduce TB incidence and mortality by 2030. But I want to ask a critical question. Can we achieve TB elimination without involving workplace? Yeah, if we see that more than 60%, yeah, in productive age group, of course the answer is absolutely no, because the workplace is where adults spend most of their time, and if transmission happen there, then the intervention must also happen there. Yeah. Next slide, please. Yeah. We see from worker health context, yeah, we know that safety and health are fundamental human rights. Therefore, it is essential to ensure workers' health and safety on the job. But we know while working, workers also exposed to workplace hazards, yeah, many workplace hazards that can affect their health, and additionally their behavior, yeah, and occupational healthcare service system. This also play roles in workplace health and safety, and can affect the workers' health, yeah. This also include the potential for the transmission of tuberculosis in the workplace. As we see in here, Indonesia has more than 153 million workforce and employ 145 millions. So we can imagine if even a small percentage is affected by TB, the economic consequences become enormous. So we are not dealing only with the disease, but we are dealing with a loss of productivity, absenteeism, burden for insurance also, and long-term disability. Yeah, so this is big problems for us. Yeah, that's why we have to work together to prevent this condition. Yeah, especially in workplace. Next slide, please. Yeah. Yeah, we have regulation. We have regulation which support the program. Yeah, for example, this is one of the regulation governing community participation, partnership, and other stakeholders to work together to address the issue. Thus, TB management can also be done in the workplace, but sometimes the problem happens because not all workplace implement implemented standard cost program and also integrated with TB program. Yeah. So next slide, please. There are numerous challenges related to TB problems in the workplace. We are ranging from promotion, prevention, early detection, treatment, anti-rehabilitation, and additionally, there are challenges faced by workers with TB, such as stigma, treatment adherence, about the cost, lifestyle, and etc., all of which need to be effectively managed. Next slide, please. Yeah, this is the problem in the workplace. Yeah, stigma. We cannot deny that there is still many stigma for tuberculosis patient. Yeah, from the recent research. Yeah, the data is about almost 50%. Yes, stigma causes them to hide their illness. Yeah, they are fear of being fired. Yeah, so they are hiding their illness. And their fear of seeking treatment also, but they do not change their health behavior also. Yeah, so this is become worse for them. Yeah. For workers with low education, they are also likely to have poorer hygiene and sanitation practice too. And the risk of transmission can also occur among workers and as well as on their family too. And of course, there's problems with the productivity and costs. Yeah, for the cost, it comes from direct costs, for example, medical treatment costs, loss of their work days, and indirect costs usually become bigger than direct costs. Yeah, productivity absent and etc. From the research done by Ministry of Health, it showed that in 2017, yeah. The economic burden of TB reached around $6.9 billion US dollar, and the productivity loss almost $700 million. Yeah, so this is not only a clinical burden; it's also an economic crisis. Yeah, this is why TB is not just a public health issue; it is an occupational health priority we have to do in our workplace. Yeah, next, please. For the risk of TB in the workplace, we know that workers spend approximately 2/3 of their adult life at work, and many workplaces have not so good situation. Yeah, for example, limited ventilation, high density population, so close contact between workers, and prolonged exposure. Yeah, besides exposure to other workplace hazard, yeah, which can impact to their health also. And all of these are ideal condition for TB transmission. Now we can consider also for a specific workplace setting, for example, healthcare facility, mining industry, construction site, yeah, dormitory, and prison as a congregate setting. Workers in this condition also have high risk environment. In fact, transmission risk in healthcare setting can be up to 10 times higher also. Yeah, but we can see that protection to healthcare worker still low also. Yeah. Okay. Next slide, please. Now we must be very precise in our classification for tuberculosis because there are two main categories. The first one is occupational tuberculosis. This occurs when TB is directly caused by workplace exposure. For example, in healthcare workers, yeah, prison, nursing home, and workers exposed to silica. And the second one is the non-occupational TB. This is TB that is not directly caused by work, but the workplace contributes indirectly to transmission. Yeah, for example, overcrowding, workers population, yeah, ventilation issue, and others hazard in the workplace. Yeah, why is this distinction important? Yeah, because it determines legal responsibility, compensation, and of course, prevention strategy. Yeah, so we have to classify this tuberculosis, yeah, become occupational or non-occupational TB. Next slide, please. Now let me highlight one critical condition, silico-tuberculosis. Yeah, workers exposed to silica dust have significant increased risk of tuberculosis. Pulmonary tuberculosis risk increase nearly threefold, yeah, and extrapulmonary TB risk increase higher, even higher, almost 4 times, yeah, than usual. Why this is happen? This happen because silica damage the macrophage and weakens the immune response, and this allowing Mycobacterium tuberculosis to replicate more easily, enhance intracellular replication of this Mycobacterium. Clinically, this condition is more difficult to diagnose. We need to use radiology exam. Yeah, it is not easy to implement. Yeah, not all facility can do this examination, and the second one is with CT scan. Yeah, the cost is also the problem, and BAL. Yeah, the clinical symptoms usually same as pulmonary tuberculosis and common extrapulmonary tuberculosis. Yeah, so for treatment, it needs a longer period also. Yeah, more difficult. Yeah, needs about more than 8 months to prevent relapse and more likely to relapse also. This is a classical example, yeah, silico-tuberculosis, the interaction between occupational exposure and infectious disease. So recommendation for workers exposed to silica, they have to check regular chest X-ray and IGRA test to detect latent TB. Yeah. Next slide, please. This is the legal basis for the workplace tuberculosis program. Yeah. Indonesia has already a strong legal foundation. There are laws governing about occupational safety, occupational health, and also tuberculosis control. Yeah. Importantly, there is a specific regulation on TB control in the workplace. Next slide, please. This is the regulation about TB control in workplace from Minister of Manpowers. Yeah. In this regulation already stated that employers have a responsibility to implement TB prevention and control programs. Yeah, they have to make a policy about tuberculosis control. They have to socialize this information, and educate the workers about this prevention. Yeah, do case finding, management, and until health recovery already mentioned in this regulation. Yeah. Next slide, please. Now let us look at this classical concept, yeah, about 5 level of prevention from Level and Clark's. Yeah. We can see from the primordial policy into environment. Yeah, the primary prevention, we can do health promotion by education, yeah, and give specific protection, vaccination, improve the ventilation and worker condition, yeah. And secondary, for early detection, we can do screening regularly, give treatment, and restrict the disability. And for tertiary prevention, we prevent disability and how to prepare the workers to work again, yeah, if there is some disability after got the disease. Yeah, the workplace is very unique because it allows implementation of all these levels simultaneously, from policy to early detection to treatment until rehabilitation. Next slide, please. Yeah, For health promotion, we know that workplace is an ideal setting for health promotion and TB prevention because workers spend long hours at works. Yeah, minimal they spend about 6 hours at works, and the population here is homogeneous also. So we can give education with the same level, yeah, same level language, and we can monitor about their progress too. And don't forget that workers also a decision maker in their family, and they can become agent of change in their community. This is one of the benefit too when we give education for workers. Yeah, we hope they can give this knowledge to their family, their community. Yeah, to prevent about this disease. Yeah, next slide, please. Yes. One of the biggest challenges is in TB is not a diagnosis, but behavior. Yeah, many workers delay seeking care. Why? Because of stigma, their fear of discrimination, fear of losing their job. So, education is very critical. We must emphasize that TB is curable disease. Yeah, TB is not a curse. It can be cured. Yeah, treatment is effective and early detection can save lives. We have to give education to reduce the stigma and promote adherence. Yeah, because for OAT, if we do not supervise it, yeah, they usually stop if they already feel better. Yeah, of course, we have to educate them. So medication adherence, yeah, can be continue until they finish the treatment. Yeah, and we also encourage early reporting. Yeah, because some of them maybe fear to report their disease. Yeah, to the company because they are afraid that they will be fired. Yeah. So stigma is one of the biggest barriers. Yeah, many workers delay diagnosis due to fear of job loss. Yeah, so this is how we can give education. Yeah, to change their behavior, also healthy lifestyle. Yeah, case reporting, and also prepare counseling services if they need it. Yeah. Next slide, please. Now let's talk about detection. Workplace is an ideal platform for early detection of TB cases. Yeah, we already have regulation to support this too. Labor health examination regulation. Yeah, so workplace is an ideal platform for pre-employment screening, periodical medical checkup, and of course contact tracing, especially for high risk group. Yeah, silica exposed workers and workers in crowded or highly density environments and workers in congregate setting. Yeah. This is where occupational physician play a key role or strategic role, how to manage the checkup, yeah, what to do when there is symptoms of tuberculosis and how to do close contact investigation in the workplace. Next slide, please. Principle of TB management, yeah, we have two principles. The general principle is a diagnosis and then treat it with appropriate regimen. And of course, we have to monitoring, yeah, monitoring about the not only the medication adherence, but also the efficacy, the adverse event. Don't forget that tuberculosis drug has sometimes had side effect. Yeah, so we must control it. Yeah, and early detect if some side effect occur in the workers. Yeah, in the patient. Yeah, and also we have to make diagnosis by screening who have symptoms such as cough for more than 2 weeks, weight loss, yeah, and then a fever and hemoptysis, yeah, we can refer them to do chest X-ray and use diagnosis tests such as TCM or culture or drug sensitivity testing and IGRA for latent tuberculosis. Next slide, please. This is our TB diagnosis flowchart for a patient with suspected TB. We have to check with TCM, and then if there is positive cases, we can continue to check whether this is still resistant or sensitive with rifampicin, and continue the check until we can make decision how to treat this patient. Next slide, please. Now we're moving into treatment management. Standard TB treatment lasts at least 6 months, yeah, especially for silico-tuberculosis, more than 6 months. And regimen usually used in intensive phase is INH, rifampicin, pyrazinamide, and ethambutol. And for the 4 months follow-up, we use INH and rifampicin. We do monitor for sputum smear at the second and the 5 or 6 months, yeah, before they stop the treatment. And for drug resistant, requires longer treatment and more complex regimen. Yeah, we use specific regimen for MDR and XDR categories, and usually use like requires second line drugs, yeah, not the first line drugs again. Next slide. This is TB in specific condition. We have to pay special attention for TB in a specific condition. For example, in HIV and AIDS, yeah, we give intensive and follow-up phases administered daily, yeah. And for diabetic patient, don't forget to control the blood sugar. And because we give INH, and INH have side effect peripheral neuropathy, which is mimic diabetic neuropathy. We should also follow up about this side effect. And ethambutol also have side effect to eyes, almost the same like diabetic retinopathy. Yeah. And rifampicin also can reduce sulfonylurea effectiveness. So don't forget to check whether the blood glucose already control and the doses of the diabetic drugs is already proper to control the blood sugar. And for liver dysfunction, for acute hepatitis, we stop the drugs first, yeah. And then after become better, yeah, we make dose adjustment and drug combination also. The same condition in chronic kidney disease, we must adjust the dose, and drug combination should be done according to the states of CKD. And for TB miliar, if indicated, should be hospitalized, and follow-up treatment phase may be extended. Yeah. The specific condition in pregnancy, we must be careful because this drug increase spontaneous abortion risk, and of course also toxicity to fetus. But for breastfeeding mothers, there is no contraindication because it also can prevent transmission from mother to the child. Yeah. For contraceptive user, must be careful because rifampicin can reduce the efficacy of hormonal contraception also. For patient with allergic, yeah, we must be careful. We must usually we stop the medication. We check which one caused the allergic. Yeah, maybe we should do some adjustment in dosage and give allergic medication. Okay, next slide, please. This is TB management in the workplace. The key principle for workers is very simple. We call it tempo. Temukan, pisahkan, dan obati. Yeah. Find early, separate it, treat appropriately, and prevent transmission. Yeah. We treat the workers with the national standard, as I mentioned before. And then we make identification also. This is occupational disease or non-occupational disease. If occupational disease, yeah, for special condition, we have to report it to the workers' compensation insurance, yeah. So they got the compensation if this is an occupational disease. And for workers with TB, we also give minimum 2 weeks sick leave, yeah, to prevent transmission and followed by re-evaluation. Yeah. For the community and work environment, we should do tracing and screening of co-workers and also family members. Yeah. And then check again about the environment. Is there any condition that should be controlled? Yeah, to prevent the transmission. Do some surveillance for early detection, and don't forget to identify workers vulnerable to infection. Yeah, for priority of early detection and provision of tuberculosis preventive treatment. Yeah, for example, for workers with HIV or DM, diabetic mellitus. Yeah. Next slide, please. This is about management in the workplace. Yeah. Management in workplace must be systematic. Yeah. First, we have to make internal policy. This is to support the tuberculosis prevention. Yeah, we make a non-discrimination and non-stigmatization policy. And then the management should have a commitment also to improve working environment and occupational health services for this program. Integrate it with others OS program, yeah, and do HIRAC and give comprehensive occupational health services also. Participation of other related parties also important. Here, government can strengthening the commitment from regulation, give access to service, yeah, maybe budget also, resource monitoring, yeah. Employers, of course, we need their commitment, yeah, when we do this program at workplace. And about the supporting for anti-discrimination policy, yeah. Confidentiality principle is also important. So workers not fear to declare about their disease. Yeah. We also collaboration with OS committee, labor unions, and of course the workers itself. Yeah. Resource, facility, infrastructure, and logistics should be prepared also. Yeah. Logistic and service network. We have to make collaboration with internal management and also external network, for example, with hospital, clinics, and laboratorium or pharmacies outside our workplace. Next slide, please. So this is not a standalone program. It must be integrated into occupational health service and risk management, a system-based occupational health approach. Yeah, because this program can give benefit, early detection, and protecting the right of all workers. Yeah, because of other workers also have right that they are safe when they are working. Yeah, no fear of transmission of disease in the workplace. Yeah, the basic principle for this program is elimination it from the workplace. Elimination this TB from workplace because it affects productivity, and we must implement non-discrimination and non-stigma policy. Also, we must make sure that confidentiality principle is applied in this program. Yeah. Strategy by making policy, commitment, and until monitoring and evaluation about this program. Is it can be running well or not? Or is there any problems that we have to improve or fix it? Yeah. Communication, information, and education also important. All policy should be communicate to all management and workers. Yeah. Clean and healthy lifestyle also should be educate or give training to the workers, about and then about nutrition and fitness improvement also important, Case finding, active, we can do it active by medical checkup, investigation, close contact, tracing, vulnerable population. And for passive case finding, we can get it from workers seeking treatment at the company clinics, or they report it if they are seeking treatment outside company clinic, and report also from other workers or supervisor. We also create task force for this program, which consisting of company leaders, managers, supervisor, or steering committee, HSA team, company clinic, labor union. Their assignment is to find case, management, and also referral, and then the importance also supervisory about medication adherence, and do monitoring evaluation also, Partnership is also important. We can go collaboration with local governments, and also with the Minister of Health, or Manpower's Bureau, local bureau, and public health center, hospital, and laboratory. Next slide, please. This is the scheme show about company clinic roles. Company clinics role can play roles and have collaboration with external party. For example, public health center, clinics, hospital, laboratory, and pharmacies also. And of course with the local governments who can support this program. Next slide, please. Company clinics role. Company clinics play critical roles because company clinics is part of district-based public-private mix in the TB control for active case finding. So they must detect TB cases, confirm the diagnosis, initiate treatment, and report to the National Information System for TB, and coordinate it with the public health system. So company clinics not just a service provider, but they are also frontline TB control units at workplace and are part of the national TB control strategy. Next slide, please. This is the reporting example in our information system for tuberculosis from Ministry of Health. You can see here that we have to report the tuberculosis sensitive drug patient and resistant drugs, and about the treatment also. Next slide, please. This is for healthcare facility. We integrated into hospital or clinic ostrich management and occupational health services. We also learn about this hierarchy of control. First one is elimination. Of course, we implement about universal standard precaution. And also disinfection of TBC service room. We do also engineering control by negative pressure room, and then HEPA filter, and use of biosafety cabinet when checking the specimen. And for administration control, we can do screening, diagnostic about waste management procedure, And for PPE, the standard is by using infection prevention control PPE. For example, N95 mask. Next slide. About diagnosis and management of TB in workplace. As previous outline, early detection can be achieved through pre-employment periodic and specialized health examination, as well as contact tracing. Furthermore, to confirm the diagnostic, clinical manifestation, risk factor, and test result are evaluated. Next step is diagnosis confirmation. Yeah, we can differentiate it. Is this occupational or non-occupational by 7-step occupational diagnosis procedure? Yeah, conducted to determine whether this is related to work or not. Yeah, and then for the treatment, yeah, oral anti-tuberculosis therapy is administered, and medication adherence is also should be monitored. Yeah. In individual management, fitness for work is assessed in the early phase. Yeah. We give work restriction at least 2 to 3 weeks. Yeah. To prevent infection transmission. And for community-based management among workers is also necessary to prevent transmission, yeah, including hierarchy of control, education, and also counseling. Yeah. For advanced assessment can be done by occupational health specialists. We assess the fitness to work and return to a program. And if there is a disability, we have to assess also. Next slide, please. This is the treatment. Okay, we already mentioned. Yeah, for the first line drug, the second line drug for drug resistant TB. Yeah. Next slide, please. This is the regulation from Ministry of Health about occupational disease health services. There is a step for diagnosis occupational tuberculosis. Yeah, from the first step, we determine the clinical diagnosis, and then evaluated about the job, yeah, to know about the occupational risk and determine the causative agent, the duration of exposure, minimal 1 month. And we investigate also about individual risk factor and other factors outside of work. And after that, we can conclude, is this occupational or non-occupational disease? Next slide, please. Now, another important aspect is fit to work and return to work assessment. Workers with TB must be assessed carefully, yeah, to ensure medically that workers can perform their duty effectively without posing a risk to themselves, other workers, or the work environments. We must consider about the infectivity, about the lung function, and work demands. Return to work should also be safe for the worker and for others workers too. Important consideration, minimum 2-week restriction from work, yeah, to prevent transmission. And then we evaluate again whether the bacterium is still positive or not. If already negative, yeah, we can evaluate again about the health condition. Is there any other side effect of the drop? Yeah, the drug. Yeah, about the job demand, the risk. Yeah, etc. And then fitness to work assessment. From fitness to work assessment, we have to see about the capacity evaluation. Yeah, adjust the work if needed, and especially in drug-resistant TB, lung impairment, or silico-tuberculosis. And then we can declare whether this workers is fit to work or there is still another nodes or temporary unfit. Yeah. Next step. Next slide. Yeah. Finally, about recording, reporting, and evaluation. Without data, of course, we cannot evaluate the programs. Yeah, and without evaluation, we cannot improve outcomes. This is critical for surveillance, policy evaluation, and of course for national TB elimination. We can use information system for TB, national TB reporting system from Ministry of Health, and standard TB forms for reporting. For occupational disease, it is also necessary to report it to the Employment and health office, and for occupational disease diagnosis should be reporting to Workers' Social Security or a National Insurance Agency, as we have, for example, BPJS Tenaga Kerja, Taspen, and etc. according to the workers' membership. And of course, monitoring and evaluation also important, need to be carried out to assess the success of the program. We have to discover any problems, any barriers, yeah, and how to fix or improve it. Okay, next step. So let me conclude this presentation that TB in workers is both a medical condition and also an occupational issue. Workplace is one of the most strategic setting for TB prevention and control, and elimination of TB requires collaboration between governments, employers, health professional, and of course, workers themselves. They have to participate in this program. Yeah. Let me end with this reflection that if we want to eliminate tuberculosis by 2030, we cannot do it only in hospital. We must go beyond hospital. We must go where people live and more importantly, where they work. Yeah, because 60% happen to productive age group. We must go into workplace. Yeah, where people spend their lives, and that is where prevention can truly happen. As an occupational professional, we do not only treat disease, we have to protect workers, protect their productivity, and protect the future of the workforce. That is all I have to say regarding TB management in the workplace. I hope this information proves useful and helps to improve workplace TB control programs. We in Perdoki also already published the book about guidelines for tuberculosis control in the workplace. So if you are interested in that, you can contact Perdoki also. Thank you for all your attention for my presentation. I hope this can useful for all of us. Thank you.
Thank you very much, Dr. Rima. Your presentation is very wide-ranging and seems to have covered all the bases, so to speak, and really impressed by that because, well, like you said, in Indonesia, the number of people involved or ill with TB is very, very high. And same thing in Malaysia as well. It's quite high, but not as high as in Indonesia. And therefore, because earlier this year, in February, our Minister of Health got really panicked because there was a sudden upsurge in number of cases of TB reported to the Ministry of Health. Yeah. And the number was just 2,571 cases, which is rather unusual. Hence, we thought, it'd be worthwhile to talk about this in terms of, your experience in Indonesia, since you have had this program going on for quite some time. Okay, on that note, I think there are a number of questions which has been sent under the chat box. So I'll just go through them as quick as I can. Okay. Well, so there's a question like, does anyone know the incidence of TB in Malaysia? Like I said, the latest figure given by the Ministry of Health in Malaysia for the first 2 months of the year, that means January to February of this year, 2,571 new cases were reported to the Ministry of Health, which shook them a bit because it was quite surprising. Yeah. Now, there's another question on if there's a factory worker diagnosed with TB, is there a role for air sampling of TB to assure management that a particular area is safe for workers? Dr. Rima, do you have got any comments on that?
Yes. as a matter of fact, we do not check whether the air is free from TB bacteria or not, because
yeah. There's no
TB
way.
bacteria is everywhere. Yeah, we cannot make sure. We just can control about the risk. Yeah, by make a good ventilation. Yeah, wearing masks for workers if they are sick. Yeah, and not so crowded in a room where they are working. Yeah, and we have to do regular checkup to early detect it. Yeah.
Yeah, I think I
Is
agree
that
with you,
clear?
Doctor. Yeah,
Yeah.
I agree with you, Dr. Rima. I think
Yeah.
in order to take air sample around the workplace to see whether there's any
Yes.
bacteria is kind of difficult, number one. And number two, I think it's more important that if there's a known case in the workplace,
Yeah.
that people should start wearing their face mask where possible. Yeah. And yeah, so that's I guess that's the answer to the question. I hope it satisfies the person who asked the question, Dr. Satya. How many cases of silico-tuberculosis among workers in Indonesia? Is it a real issue, or is that is it increasing or being controlled?
Yeah. As a matter of fact, we do not have the real numbers of the cases, yeah, because as I mentioned before, it's not easy to detect silico-tuberculosis because not all facility can check with radiography or CT scan. Yeah, so we have no data about it, but we are sure that these cases is like iceberg phenomenon. Yeah, we cannot see the real number, but
Yeah,
it happens. Yeah,
yeah,
we just cannot detect it now. Yeah, maybe if we can search it. Yeah, we have to do research about that. We can find more
sure.
cases with silico-tuberculosis. Yeah.
Okay, thank you. Now, there's the question about the policy on wearing face mask by a hospital, a healthcare worker, basically, having latent tuberculosis. So what's your view on that? That if you're a healthcare worker and you have latent tuberculosis or diagnosed,
Yeah.
I think it is important that a person actually wears a face mask. Did you agree?
Yeah. I think we still remember when we are in COVID condition. Is it right?
Yeah.
Where all healthcare workers should wear masks because there's a possibility of high-risk transmission from COVID. I think this is the basic standard for infection prevention control in a healthcare setting. Isn't it right, Dr. Abed?
Yeah.
So, maybe there is no regulation, but for the infection prevention control policy, we should have wearing masks because we cannot sure which one of our patients have tuberculosis.
Yeah.
And from the research show that latent TB in healthcare workers is very high, about almost, I found the data about almost 60%. Yeah, 20 to 60% healthcare workers have latent tuberculosis. But maybe we do not check all the healthcare workers, so we cannot get the real data about it. Yeah, but I'm sure if we are not consistently wearing masks when we are give service to the patient, yeah, we have possibility to have latent tuberculosis, and it just wait until our immune is become weak, the disease will appear. Will appear. Yeah. Yeah. So for healthcare workers should protect themselves earlier before they protect others also. Yeah.
I see the point. I think all healthcare workers working in hospital setting, clinic settings, and all that, dealing with all kinds of patients, I think wearing a
Yes.
mask at all times during the course
Yeah.
of their work would be a very reasonable thing to advise healthcare workers on the importance of wearing a mask, because we do not know, not only just tuberculosis, any other infectious conditions may be,
That's
you
right.
may be infected. Yeah. Okay.
Yeah. We also protect ourselves, protect the
The
patient also,
patient
yeah,
as well.
doctor.
Yeah, both ways.
Yeah.
Yeah, it works both ways. Yeah. Okay. Okay, let's see on. We have done the silico-tuberculosis. Was a policy of wearing face masks by hospital staff? I think we've discussed that. I think it's important to wear to protect yourself as a healthcare worker, as well as also to protect your patients. Yeah. Okay. The role of BCG. I assume that BCG is still given at birth. Is it still given at birth in Indonesia?
Yeah, in Indonesia, BCG is still a compulsory
At birth.
vaccination for children.
Yeah, okay, same thing in Malaysia as well. So the question is, of course, if we have had BCG at birth, theoretically we are protected. But of course, over a period of time, I guess the immunity wanes off, I suppose. Yeah. So maybe those who do get exposed to tuberculosis and do succumb to tuberculosis, even though they've had a BCG as a child, maybe because their immunity is lowered, number one, or maybe there's a new strain of Mycobacterium tuberculosis that's present at that point in time. Yeah.
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 I think so.
Yeah. Okay, there's a question here about the use of quantiferon tests for pre-employment. For those who are not familiar with quantiferon tests, it's for mainly to identify latent tuberculosis. This is a special test. So I don't know whether in Indonesia they do that or not routinely to identify latent tuberculosis.
Yes, because this is a high cost.
Cost, yeah, it's the cost, very expensive.
High cost, expensive. So this is not a routine test for pre-employment. Yeah, we still use a test X-ray. And
okay.
if there is suspicion about TB, we go to the next test, yeah, like TCM. Yeah.
Yeah.
You know that Indonesia has so many population, yeah. So and cost is also one of the problems to do this check. Yeah.
Now, there's a question about giving the risk of long-term, TB and all that, and the concern about the whether the patient actually takes the medication regularly and conscientiously or not. So have they all used what we call the DOT, which is direct observation of treatment? In some workplaces, I know they actually, they have a clinic on site. The employee has to go to the clinic every day, Monday to Friday, to get a medication, and then they get a supply for Saturday and Sunday to bring home. Yeah. So I think that was one way of trying to increase the level of compliance, of treatment.
Yes. Yes, we do it also. If the company has a clinic, we ask the workers to go to clinic to take the medicine
every day.
So direct supervisor. Yeah.
That's right. Yeah.
Because sometimes if they feel already well, they stop the drugs.
They
If we do not
That's the problem.
continue supervisory. Yeah.
Now there's another question here. Well, this is a comment made. It says that if the national standard does not include preventive TB treatment in the guideline, should employer enforce or provide prophylaxis for contacts of positive PTB to further mitigate spread of work? That means, if the national policy does not include prevention and all that, so can the workplace do it on their own. Of course, you can. I think if that's the purpose by the management to try to mitigate this issue about the spread of TB.
Yeah, this prevention treatment for TB now in Indonesia only give to special condition, for example, HIV patient and household contact. Yeah, not
Yeah.
all.
Not all.
Yeah, because the
Yes,
cost is one of the problems, and about the drugs is also the problems too. Yeah,
because there's always
there are so
concern.
many.
There's
so
also
many
concern
population.
about there's concern about in creating resistant strains and so on and so forth as well.
Yeah, and we must also remember there is many resistancy about this, because they don't feel they have TB. Why should they have this treatment?
Yeah,
And this is
true.
the barrier too when we
barrier,
want to give them the prevention treatment. Yeah.
Now, there's a question here. When an Indonesian citizen diagnosed with TB abroad returns to their home country, how do these patients continue their treatment or management?
Pardon? I cannot catch it.
Okay. If, for example, in Malaysia, we have a lot of Indonesian workers here who come, either as a legal foreign worker or illegal foreign worker. And if they are legal, they have to undergo what we call a health checkup. Yeah. And the moment you're found to be positive or have evidence of TB, they're immediately sent home back to Indonesia. So if there was such a person here who's been sent back from Malaysia to Indonesia, who's said to have TB, would they, I don't know whether they will be recorded immediately, officially under the Department of Health for treatment, or do they have to go on their own to get treatment?
Yeah, that is one of the big problem too. If they do not report it, or they do not go to the public health center for treatment, and nobody's reported, we cannot get the data of this patient and cannot give the treatment. That is one of the problems too when we do TB management in community.
Yeah. Okay.
Yeah.
So,
I think that's why important to always give education to community about this disease, so they don't have fear to declare about the disease, and try to seek medication, because usually they think this is curse or other disease that cannot be cured, so they do not want to seek treatment again.
Sure.
Education is important for our community.
Yeah, that I agree completely with you. Now, there's a question, say, if a worker contracts TB from a fellow co-worker who is a known case of TB in a factory setting, is it considered occupational or non-occupational?
Yes, occupational disease for TB is only for a specific job. For example, healthcare workers, laboratory workers who check the specimen, and non-healthcare workers who handling the waste or specimen of a TB or have contact with the TB patient. Other than that, we do not set this occupational disease. Only for silico-tuberculosis and for special work job, for example, for healthcare workers.
I think the question
like already mentioned in the Ministry of Health Regulation.
In this particular instance, it is this worker, say for example, I have found to be suddenly found to have tuberculosis, okay? But because I was working with a colleague, a co-worker who already has been diagnosed, and I've been working in close contact. Now that I've got TB, would
Yes.
my TB, because it's work related, it is in the sense because of the connection that it is the temporal or time sequence, My
Yeah.
colleague got TB and I worked with him and then I developed TB as well.
Yeah.
Or I suppose like a healthcare worker treating a
Yeah.
patient with TB, yeah? And the health worker gets TB as well. So I think in that sense, I think it is work caused by the work or the nature of
Yes.
the work they do.
Yeah.
Yeah.
Yeah. Besides healthcare workers, we cannot say that this is occupational TB because TB is a community disease. Yeah, community
Yeah.
disease. They can get it everywhere,
Mhm.
not only from in workplace, but also from their community. Yeah, maybe
Okay.
workplace condition can facilitate the transmission, but uh, it's still not categorized as occupational TB in our
Okay.
context here. Yeah.
Another question which is quite interesting is because in the Malaysian context, workers who are working with silica in the workplace, they have undergo chest X-ray, lung function testing, and so on and so forth. Yeah. The question they ask here is, would also periodic TB screening be done as part of the medical surveillance of such workers?
Yeah, we should do a periodic surveillance for
Yeah.
this patient. For
Even,
example,
yeah.
we can check by alloradiography, and then
Mhm.
can continue with IGRA test, yeah, quantiferon test,
Yeah.
to see whether there is
It's
a latent
latent.
TB or not. Yeah.
Okay. All right, good. That I agree with you as well. Yeah. Oh, good question. Is there any role for centralized air conditioning system in contaminating clean area? Well, it's not necessarily with TB, but just the indoor air quality of a centralized air conditioned space. So what is the role of such centralized air conditioning system in maintenance of the quality of air in a facility?
I think this is the same as we are in COVID condition, yeah, for
Yeah,
central air conduction, on condition, yeah. We should put UV in the ducting system to kill the bacteria. I think this can be done also for this
okay.
condition.
Mm-hmm.
Is that right,
Okay.
Dr. Abed?
Yeah,
Are you agree?
I think that was I think the question was, how can we, centralized air conditioning system, how can we make sure that that couldn't be the source of spread of, bacteria or viruses or what have you, in
Yeah,
the system? Yeah. Okay.
yeah.
Uh,
Because TB is a community disease, yeah, so it can be everywhere, I think. The problem is how to detect it earlier, yeah, and then separate this patient, give treatment, and uh, active finding the others suspected, yeah, suspected workers, and do the same cycles again. That is more important
Yeah. It's always the
because
prevention
everybody
part.
have
Yeah.
chance to get TB, I think.
Mhm. Okay, one question here. How to convince management of the importance of this program, meaning TB prevention control, as there is no direct financial effect and business impact if they don't conduct the program.
Yeah.
I think Dr. Rima, you already said that there is an impact if you don't do it, and people start falling ill in the workplace. So
Yeah.
eh,
I, yeah, I think we should propose to management uh and show them the impact. Yeah, this is not about it's not only a direct cost from this TB cases, but also indirect costs. Yeah.
mhm. Yeah,
the
there
cost
is,
when
isn't
we
it? Yeah.
recruit new workers, to
Mhm.
replace the sick workers, there is cost also. And then how if they are present, can they work as before?
Mhm.
Maybe
Yeah.
the productivity is become lower than
Less.
usual because of the lung function problems.
Mhm.
Yeah. That is all we can show it to the management. Yeah. From the research also, as I mentioned before, it takes about $700 million loss of productivity here.
Activity, yeah.
Yeah, it's a very big
Yeah,
amount
that's true.
of money.
Mhm.
Yeah.
Now, there's a question about, in terms of treatment of an employee or worker with tuberculosis, how long do we treat them for, and what do we need to do to ensure that they are, at which time can they be non-infectious and can come back to work, even while on treatment?
Yeah. Usually we check it again after 2 weeks, because after 2 weeks, usually the bacterium reduce until 50%, only 50% or negative, And then if they are still positive, we still continue to prevent them to work again, and check it again and make sure until the bacterium is negative. If the bacterium already negative, they can work again. And of course, we have to check about their health status first. Is there any other problems, other side effect of the drugs? And still ask them to wear the mask, because although the mycobacterium also already negative, they still can have possibility to transmit about 15%, but if they are wearing mask, this possibility become less. So they can still working after 2 weeks if the bacterium already negative, but if still positive, we have to continue restrict them from working until it become negative. We check it again from the government regulation in Indonesia. We check it again in the second month, and then 5th or 6th month before the treatment finish. Indonesia regulation like that.
Okay. All right. We are
clear?
really, we are really going way over our time slot, which is good in the sense that there's a lot of questions, a lot of people wanting more information. Because I'm looking at the attendance here for this particular webinar. This is the highest number of people we have ever had. So, Dr. Rina, you have been very popular. Everybody wants to hear what you have to say. And of course, the topic itself is very topical. And we'd like to, on behalf of AOEMM, like thank you very, very much for the effort you have
so much.
taken. Now, before we go, I just want you all to have a look here. As you know, there is the ACOH 2026. The Academy of Occupational Environmental Malaysia is the official organizer of this Congress to be held in Kuching, Sarawak, Malaysia, between the 5th and the 8th of August of this year. So we would like to inform all of you about this Congress, and would like to invite you all to come and join and participate and attend this Congress. For those who have done research and got papers that they want to share, you can always submit your paper in either as a paper, as an oral presentation, or if you want to, you can reduce it to a poster for the poster presentation. So there are two parts, oral presentation and poster presentation, yeah, of the work you have done or the research you have done or whatever you have that you want to share with, with all the attendees at the conference, at the Congress, yeah. So I'm glad to inform you that the closing date or the deadline of submission for your oral or your poster presentation has been extended to the end of this month. So you can still have an opportunity to submit your your presentation to us so that we can consider it for to be shared at the conference. That's number one. And number two, and even if you don't want to do any of this stuff, you want to attend, you can still attend. You can still attend the conference. And the registration fee is still using the early bird registration fee. We have extended it till the end of this month. So you can still get a cheaper rate of registration, even if you don't want to do any presentation. Okay, so please consider this. And if you have colleagues or friends who might be interested, you can share this information with them and come to Kuching, Sarawak for the Congress in August. Okay. Now, the next thing, I think for those who are here, especially Malaysians, you want to get your CPD points. We'll show you the QR code that you have to register with. Yeah, this is the QR code. Yeah. Scan this and submit your name to MMA through this code, and you'll get the points for your CPD. Yeah. Okay. And of course, I think we will be having, oops, can you hold on music, please? Yeah. So in addition, we will have some webinars between now and August. So please be on the lookout. We will send out announcements of the next webinar pretty soon. Yeah. So that you can always join in, depending on the topic you're interested in and so on and so forth. But if you have any topics that you think we should be consider as part of the webinar, you are also welcome to inform us at AOEMM, yeah, and suggest topics. And if you know someone who is an authority on the topic, you can even suggest the name of the person, and we can get in touch with that person to see whether he or she will be available to present the webinar. Okay. So on that note, thank you again very, very much for your attendance. And thank you, Dr. Rima, for your very, very useful and very wide-ranging topic on TB at the workplace. So with that, I will say goodbye. But don't forget, there'll be a video, there'll be recording of this on the AOM website soon, once we got everything together. Okay. Thank you very much again.
Thank you very much, Dr. Abed, and all
Terima
the
kasih,
Agwen.
Dokter. Okay, terima kasih ya.
Thank you.
All right. Bye.